You're listening to Navigating Eldercare, where you'll find guidance and answers for every step of the eldercare journey. Each week, Eldercare advocate Laura Daniels brings you expert insights and practical solutions to help families and professionals make confident care decisions.
Hello, my name is Laura Daniels, founder of Care Advocates and your host for Navigating Eldercare. For years, I have been helping families, medical providers, doctors, case managers, social workers, nurses find the right solutions for seniors in transition, whether that is after a hospital stay, a rehabilitation stay, or when the care needs at home have changed. We assist in finding the right care options. I started this work because I saw how overwhelming and confusing the eldercare process can be, and I wanted to be a guide and a resource for families and professionals. In my business and in my work at Care Advocates, we walk alongside families every step of the way. We meet with families, clients, and providers to create a customized care plan. When someone is needing more care at home, such as dressing, bathing, assistance with mobility, we provide them with options and resources such as assisted living communities, residential care communities, or resources that can come into the home. We advocate, guide, and educate throughout the entire process of us working with the family. But most importantly, we provide ongoing solutions and support. The care journey should never feel overwhelming. It should feel guided, supported, and understood. Welcome back to Navigating Eldercare. I am your host, Laura Daniels, and in today's episode, we are going to be talking about a topic that is often misunderstood, but deeply important, and that is palliative care. And my guest today is Monica Trust, Chief Executive Officer at Guiding Light, who helps families and healthcare providers understand when and how palliative care can make a meaningful difference in someone's quality of life. Monica, I thank you for being here.
Thank you for having me, Laura.
Absolutely. Monica is the Chief Executive Officer at Guiding Light Hospice. She helps families and healthcare providers understand when and how palliative care can make a meaningful difference in someone's quality of life. And Monica, you and I share something in common, our deep passion for older adults and the seniors that we serve in our community. And I've seen you the last decade, you've been working in the palliative care hospice space.
Correct. Yes. I've been working hospice and palliative care since 2016.
Impressive. Monica, before we get started, I want you to tell us a little bit about yourself, your background, and your role at Guiding Light. What drew you to work in the hospice and palliative care space?
So I am originally from Deep South Texas, and in my family, my mom was one of the primary caregivers for my grandmother. And very quickly, she got sick and realized that she was not given all the support that should have been given, I found out. And opportunity presented itself as we went through that journey and living here in San Antonio that I then was able to assist families as we were in that position. So that's what drives me.
Before we get started about palliative care, Monica, I want you to define what is palliative care.
So palliative care is a specialized medical care for people that are living with a serious illness. This type of care is focused on providing relief from symptoms and stress of the illness, helping the family to understand and to improve quality of life for both the patient and the family.
And you know that most families, when they hear palliative care, they immediately think that it means end of life. Can you clarify what it really is and how it's different, how it differs from that of hospice care, which we'll get into in our next episode next week?
Of course. So palliative care, and the difference is you can still be seeking aggressive treatment and have palliative care. When should someone get palliative care? As soon as a serious illness is diagnosed. That is very important. Palliative care is meant to help the family and the patient understand where they are in the disease process so that they are able to navigate and ask those questions to their care team. as they're going through their journey.
Monica, speaking about specifically your company, Guiding Light Hospice, what do you find the most rewarding about being part of that team that supports your patients and families during such an important time in their life?
It's helping them to understand and educating them that it's okay to be afraid. It's okay to ask questions. We're here to give them the support that they need during this time of a lot of unanswered questions and fear.
Monica, how would you explain palliative care to a family who's hearing it for the first time? How would you explain palliative care?
I would tell a family that palliative care is symptom management from an additional care team. We can come to the home. We can have and help you to navigate the questions that you may have. Some of the visits that when you go to the doctor, a specialist, those are 3 and 5 minutes,
Absolutely.
and you feel almost tied that you can't ask because the doctor goes in, and that's just the way that healthcare is designed in here in America. So our visits in the home, I know you were shocked as we were talking and preparing, is an hour.
Yes.
Because we talk about the goals of care. Where and do you understand where you are in the disease process? Do you, to the patient and to the family? Because we look at the whole picture, not just from the patient's perspective, because the caregiver has a lot to do with how the care is going to be provided for the patient.
And as you know, Monica, most of the time when palliative care is presented by a doctor and nurse practitioners, it's a quick 5 to 7 minute visit. And then they drop the word palliative care with no information, education, support. So that's why it's good to reach out and get that clarity and information from someone like you.
Yes, so palliative care is also a lot of talking and listening.
Absolutely.
What are the fears? What's going on? What questions are they not asking? We help to empower them when they go on to their next visit.
Yeah, you're educating, advocating throughout their entire care journey with you.
Correct.
So that they're going into their doctor and asking the right questions.
Absolutely.
Monica, when is the right time to consider palliative care? Is it only for those with a serious illness, or can it be introduced early in someone's care journey?
As soon as, and that's a great question, I had a doctor ask me, Monica, when should I put my patients on palliative care? And this was a transplant team. I said the first day that they walk in and have a visit with your team. Why? Because we are going to coordinate with the team to listen and educate them in their home, wherever they call home, and have the family understand. Imagine a 3 to 5, 10 minutes to an hour of having a provider be there to answer all your questions in your own environment. That has helped a lot of patients open up a lot more to be able to understand and have time to process what's happening.
Because I've seen it, they're more comfortable with you than being in front of their doctor, right? Going to a doctor's visit, it's very overwhelming. It is rushed. It is a lot of information that you're having to process.
It is a lot of information, a lot of big words, right? A lot of medical terminology. And one of our providers, she tells the family, well, what does this mean? I've sat with families where they said, well, what is that? They said it was malignant. It was a malignant ball. It's a tumor. We simplify the terminology.
Yes.
Oh, because they don't understand it all.
Yeah. Even the word palliative care.
Correct.
Some people, they do not know what that word is. So.
Correct.
Monica, let's talk about how palliative care works. Who is typically involved in a palliative care team, and what kind of support do they provide to patients and families?
So, it's a team of specialists that includes doctors, includes a nurse practitioner, it includes a social worker, it includes a chaplain, to go in and help support a family. We are looking at all of the needs of a patient and their family.
How does your palliative care team work alongside a person's regular doctor, their specialist? How do they work alongside their their current physicians that they're
So
seeing?
we work in partnership with their specialist. We work together to coordinate the care. So when our team goes in and we send all of the documentation of our visits to the specialist and call. And Dana, which is our case manager in-house, she is constantly talking with the specialist, with the team, internal team as well, along with our nurse practitioner.
And Monica, this is another big misconception that I see out in the community. Can palliative care be provided at home? Or does it always have to happen in a hospital or facility setting?
It can be provided at home, and it can also be provided in conjunction with home health.
Okay.
Sometimes that's misunderstood. Well, you can't have one or the other, because palliative care is sometimes misconstrued with hospice, but it can be done both.
And by home health, we are talking about when you have physical therapy,
Correct.
occupational therapy,
Correct.
nursing visiting you in your home. And palliative care can be provided wherever you call home. That can be you living with your mom, you living in a memory care community and an assisted living community, or your loved one living in a condo or an apartment complex, anywhere you call home.
Anywhere you call home. Correct.
What about a nursing home, like a long-term care skilled nursing
Yes,
facility?
absolutely.
Okay. Let's talk about the impact on families, Monica. What are some of the most common fears or misconceptions that families have about palliative care?
That it's hospice, that they're no longer going to be able to get curative treatment. And that's not the case. You can have all the curative treatment when you're going through palliative care. That is what we do. We help to symptom manage the treatment. Let's talk about cancer, a diagnosis of cancer, going through chemotherapy, and me seeing it firsthand with my mom. There is nausea, there's vomiting, no eating, you get chills. We go in and help the family to understand that those are the symptoms of aggressive treatment, and still have the conversations. Is this something you want to continue? Because a lot of times some patients do not, and the families struggle. It's like an internal tug of war that happens in the family dynamics. There's a lot of suffering that happens when a patient is going through treatment. And sometimes there's not. Every situation is different.
Absolutely.
So we adapt to each patient and the dynamics of the disease and where they are.
And that's by providing a lot of ongoing education,
Correct.
support for everyone, not just a patient.
The family especially. It's very important that the family understand where their loved one is in the disease process.
And that changes, right?
Yes, it does.
It could change every day. It could change every month.
Yes, it can.
Right. And you are there to walk alongside that journey.
Absolutely. We're there to walk alongside the family and help them understand. And we'll tell them, do you want us to make a call to the doctor? A lot of patients say yes, and we do that.
You make the phone calls.
Yes, our case manager does in-house.
Monica, how can palliative care help families, not just patients? How can it help families, especially when it becomes very emotional and spiritual and just the practical support? How can it assist a family?
So it can assist a family of what's to come, planning ahead, right? Is my treatment, because we all focus on quality of life. It's important. Is the treatment I'm getting going to affect my quality of life? How is that going to affect my family? What can the family expect to see out of their loved one as they go through their journey in getting curative treatment? It's important that they understand what are the symptoms, what are the dynamics. They could end up back in the hospital if we don't follow certain steps, what to look for if they're dehydrated, if they stop eating, because that can get ahead of us very, very quickly and get a family can get into a crisis.
I want you to share a story of a family, Monica, that has benefited from palliative care and how it made a difference for them in their care journey.
So many years ago, we had a young patient, and I remember she was born in 1975. Not to age myself, but when I looked at her age, and she had cancer in the lungs, and she was in our palliative program, and the husband was struggling. They had a child, and It was struggling to make the decision of, are we ready? Are we not, to move on into hospice? But we were able to explain to him that making that decision was okay because she no longer could tolerate the treatment. It was in her lungs. It was hard for her to breathe. And we brought in the team to help educate him, educate the child. She was 7 years old. And that was very challenging for not only him, but her, knowing that she was going to be leaving and helping her to understand and answer the questions that only an expert, a chaplain could, as the decision is made to transition. The oncologist could not give any more treatment.
Yeah. And that's part of your support team, right?
Correct.
The chaplain.
Is to assist the doctor, even the specialist, to help the family to make these decisions when treatment's no longer
working. The support that
working.
you guys provide is beautiful. You can't get that at an oncology office, and that's not being disrespectful of these doctors, but the reality is that there's no time to provide the support and the education that you provide.
Correct.
To not just that young patient, but to her husband and even a child. That's impressive. Let's talk about connecting with services, Monica. What does the first visit of a consultation for palliative care look like?
So we'll get the referral and we review it. We make contact with the family. We schedule it. Our nurse practitioner comes out, and like I said, it's an hour visit. It's digging deep how we got from diagnosis to where we're at, what led to this diagnosis, what their understanding is of the diagnosis, what they understand the doctor has explained about the diagnosis, and asking the caregiver and the patient to see if they're all on the same page. Having goals of care conversation is very important. Planning ahead with advanced directives. Our job is to get the family and the patient thinking to plan. We need a plan.
To being proactive, not
very proactive,
not reactive at the last minute.
Correct, because then at that point you're in a corner and you may not have any more choices left to make. And you don't want somebody making choices for you. I always tell families, you still have control by being educated in what is happening and having the courage, because it takes courage to ask the difficult questions to a physician. How long do I have left? These are the serious conversations that we have and that the physicians have with patients that have been diagnosed with a serious illness.
Monica, let's take it a step back. If a family wants to learn more about palliative care or request palliative care, we know that sometimes doctors won't present that as an option because they're busy or they may not present it. But if somebody wants to learn more, how do they start that conversation? Do they ask their doctor? Do they call you? What advice would you give a family?
So I have two things. One, ask your doctor, am I a candidate for palliative care since you have diagnosed me with a serious illness? The answer is going to be yes. And say, not hospice, palliative care. And then at that point, call our office, which is 210-585-2335, and ask for the palliative department, and you will get Dana. And Dana will answer all your questions and help you get connected and help you even navigate on how to ask some of these questions. If you just tell her she's a nurse and she can assist with that process.
And that was 210-585-2335.
Correct.
Give me some examples of some of these chronic medical conditions, diagnoses.
So let's talk about cancer, dementia, Alzheimer's, CHF.
That is congestive heart failure?
Yes, congestive heart failure. Anything having to do with, let's say, patients that it's not dementia, but they're forgetting a lot of falls.
Cognitive decline,
absolutely.
Chronic obstructive pulmonary disorder.
Yes,
also.
Heart failure. Sometimes that very quickly can get away from us if it's not managed, right? So we work together with those cardiologists and pulmonologists as well.
And if there's a chronic illness that you have that you're not sure of, they can reach out to you or to me to clarify if that's a diagnosis.
Absolutely.
That may be a qualifying diagnosis for palliative care.
Absolutely.
What advice would you give to families who are hesitant or unsure whether palliative care is the right fit for them at that moment?
If you're hesitant, talk with your doctor. Call our office. We will help you navigate. The more empowered you are and the more information you have and your questions are answered, and there is no obligation. This is what we do. This is who we are. We want to provide education to the community so that you're able to make informed decisions for your loved one.
And there is no cost. You're there as a resource.
No cost. We're here as a resource. Absolutely.
Monica, if there was one message that you would like to leave with families to take away about palliative care, what would that message be?
Not to be afraid of palliative care. Palliative care is a way of planning when you've been diagnosed with a serious illness to improve quality of life. We will help you as you're going through your medical treatments, helping you to match your goals of what are your goals of care, asking you those questions. That's important.
And that what is an example of a goal? Give us an example.
A goal. So what are goals of care? Meaning I want to continue treatment up until this point. I don't want to be on
a feeding
tube. I don't want a ventilator. At what point do I stop the treatment? And those are tough questions to ask, but the family has to be involved.
Because in that moment, right, when you're in a hospital and they want to do a feeding tube, a PEC tube, if you're not able to make that decision, you want your wishes laid out, right?
Absolutely. You need to have the planning ahead, having your medical power of attorney, having your advanced directives with the physician, instructing them of what you want if you become incapacitated. Who then makes those decisions? But always making sure that who you give that authority to is going to respect your wishes. That's very important.
Very important. Monica, I want you to give me one story, that one moment that reminds you of why you do what you do every day.
My family. Many serious diagnoses has knocked on the door of my family, and I've been able to help navigate, and I've also been helpless to see when my family has been stuck with fear and even denial because they didn't know. We should have been more proactive, which is why I do what I do and how we train our team to help the families understand where they are and help them advocate to be proactive.
Monica, I want you, for our listeners, if they want to learn more about palliative care, more about Guiding Light, or connect with your team, where can they go? Who can they call?
So they can go to www.guidinghospice.com. We're on Facebook, we're on Instagram, and call our office to 210-585-2335, and we can help you to navigate when your loved one or you have been just recently diagnosed with a serious illness.
Monica, I want to thank you for being here, for sharing your time and your vast experience, your insight, your compassion and clarity for helping families truly understand the power of palliative care and how important that is. So I thank you for that. It's not just about giving up, but about focusing on comfort, dignity, and quality of life.
Correct.
And empowering them to get all the information and education before making a choice.
And empowering the patient and the family to advocate for themselves is very important.
Thank you again for being here.
Thank you.
And I thank you for joining me on Navigating Elder Care, where we bring guidance and answers for every step of the elder care journey. If you are a family member, hospital case manager, or a healthcare provider, and you know someone facing a change in health or planning for future care needs, we are here to help you find the right care at the right time, whether it is assisted living, memory care, or resources that come into the home, such as palliative care or hospice hospice care. We can help you with all of those questions. Our commitment is simple: care, compassion, and lifetime support. For a free consultation, call me at 210-669-2222. Be sure to like and share this podcast. You can visit our website for helpful resources. We are at advocatern.com. You can also listen to us on YouTube or listen to us on your favorite podcast application. Or you can listen to us here every Sunday at 8:30 on 9:30 The Answer. I thank you for being here.
This has been Navigating Eldercare with Laura Daniels, providing guidance and answers for every step of the eldercare journey. For a free consultation, call 210-669-2222 or email Laura at advocatern.com. Catch every episode on 9:30 a.m. The Answer, YouTube, your favorite podcast app, or at advocatern.com.